I live in west part of Edmonton, I guess Jasper Place, Linwood area. And yeah, we've been living there since 2013. We we chose that like the west part of Edmonton because when I first moved to Edmonton, I had this friend who lived in the West Edmonton, and so I've become comfortable in the area, going to work at the cancer center, to the university. Then I was more comfortable in the area, and so when we started looking for the place, my husband and I figured that, we want a place where, as community organizers, that's something also that we wanted, a place that was accessible to the community members, right? So that we can easily connect with them. And yeah, it's funny because the real estate agent, they kept taking us to the suburbs of Edmonton, and I was like, well, we want something that's accessible by public transit, that's close to everything. And so when we found this house where we're living in now, we saw that it was close to, like West Edmonton Mall, where everybody goes, right? There's like a lot of schools, a lot of churches. And then the bus route was close. And so we were really happy to have found this house. And so, yeah, 10 years later, we have, like, say, members of Migrante, like, they know where we live, and they would just, like, knock on the door, like, like Filipinos, like, we don't, like, usually we don't call, we just, like, pass by the house. Oh, we're here, let's pass by. And so our house has been a revolving door of community members just coming by. Sometimes they would just bring, oh, we had this from work, and I figured I'll pass by, or I cooked this, I just wanted to drop this off. Or they would come by and say, Ate Cynthia, Ate being a big sister, I need help with my application, can you do this with me? And so yeah, it's been really convenient for us and for the community members as well. In the neighborhood, like I go for a walk, and yeah, I saw, like, a block away, I see, like, Filipinos working on the front yard, or they became friends with my daughter. Yeah, there has been a lot of Filipinos. The Catholic schools around the area, that's where we see, like, a lot of Filipino kids going to school, right? And then the parents that I have talked to, their kids come to the Orange Hub for, like, say, dance workshops and stuff. And so, yeah, everywhere we go, like, there's Filipino stores in the southwest, east of the house, like a few blocks where I live. From what I hear from the neighbors, from the members of Migrante Alberta that live around the area, it's accessible. I had some people who used to, like, they just came to Canada as temporary workers, and then they ended up in Millwoods. But then they just moved to West Edmonton, like, last weekend, because they said that it's more convenient. They're close to, there's like the mall, where this is the hub for transportation as well. There's like Filipino groceries, like Seafood City, for example, and the grocery stores, and it's close to their work. So, and then if we have, like, say, our community activities here at the Orange Hub, so everything is within reach by public transit. And if they live, say, for example, if they're renting a room in a house that's owned by Filipinos, for some temporary workers, that's also something that that helps, because they have that support system. They live with somebody who's of the same culture, the same language, and so it's been really convenient and having the support system around them, having the community close by, has been one of the few factors for the decision to live in the area. In the neighborhood, being close to Misericordia Hospital, and there, right next to it, there's also like a long-term care facility. A lot of the members of the community who have finished, like say for example, the caregiver program, have have gone back to school to train as a healthcare aide, for example, or nursing assistant, right? And so after finishing those programs, then they end up in the healthcare profession. So they end up working in the hospital, a Misericordia Hospital, in the long-term care. And so again, being in the neighborhood, so they live in the neighborhood and then they work in the hospital that's nearby. So that's something also that you would see a lot within the hospitals. Like you see a lot of Filipinos working in the hospital, you know, whether in their like the housekeeping staff, you know, the long-term care in the neighborhood, and working at the hospital. And so we would have activities here at the Orange Hub, for example, on the weekends, and then the members would say, "Oh, Ate Cynthia, after our session, I have to run over to, you know, my work, which is just right by the hospital." And so this is something that they've been able to do conveniently because it's close by. You know, the churches are nearby also, and so that's something that they would say, okay, after our session in the morning or in the afternoon, I would just go to church first, which is like a walking distance from here, and then they would just come to the Orange Hub and then join our session or our workshop or education sessions, whatever we're having. But I think the close vicinity of everything around the neighborhood has made it a good choice for the members, a lot of the members of the community here, because of the convenience of having everything around us. My neighbors, there's different ethnic groups. The neighbors coming from, like, say, India. I was looking for a physiotherapist one day, and I saw an ad that was, she had like an Indian background, and she's 2 blocks away. So that's been really convenient. I walk around and, I see different shops that's owned by, different community groups or neighbors, like indigenous neighbors that I was able to see in my breast cancer survivors support group from the Misericordia Hospital, which is nearby. So it's been quite a friendly neighborhood, like say in the area where we are.